Okay, I hope everybody is refreshed now. So I'm not Jo Thompson. I'm Kanwal Tariq, one of the respiratory physicians here. Unfortunately, Jo is off sick today. I hope I do justice to her presentation. She's put a really hard work into this program. It wasn't very easy, lots of challenges, and I would say it's a work in progress. We have learned a lot in the past year or so, and we're still learning and we're still making changes. So Jo Thompson has taken the role of the responsible assessor for the lung health check program. She still is our specialist nurse for the asthma with HUTH. She's band 7. So we'll start how we started to pull all the nursing team together. I think recruitment is the key, and it still is the key. It needs to be started well ahead of time, I would say. When you're planning, you would have some modeling numbers, etc. You would know how much time is needed from the nursing. For our modeling, we anticipated we would need at least 8 band 6 nurses, and we did recruit 8. I think we spent 3 months before starting the program training them. This is the amount of time needed to train them, actually. Currently, we're running at 6 for the past 8 months, so we're short of 2. So it's been a very stressful experience, I would say, in the past few months. But the recruitment is open to all staff nurses from all walks of specialities. You can see there's a combination. We had nurses from oncology, from community, from intensive care unit. Not necessarily it's limited to somebody who has respiratory skill. Okay, they all came together. They have shared their experiences and skill, to be honest, complemented each other, and they all wanted to. They were very, very enthusiastic, and they're still very enthusiastic and proud to be part of this team. But the training mainly, I'll just highlight the key training aspects of the nurses who will be running lung health check. Though we are not doing spirometries now, we were doing, and hopefully we will get spirometry again in future, it is expected. They all need to be spirometry trained, so they are all registered with ARTP, and they have received training on how to interpret basic spirometry results. All the nurses have done good clinical practice, and we do take consent for participants who attend lung health check program to be enrolled for research, so they're involved in consent process as a result. They all have received training on how to approach smoking cessation and give a brief advice on it before referring them on to the smoking cessation team. And I think this is very key element. And I have a few slides on smoking cessation later in my presentation that would elaborate this further. Apart from that, the 3 months of training before starting program, basically all the nurses, they went through the journey of any patient who has a suspected lung cancer. So they've attended clinics with us, sat in the lung cancer MDTs, seen all the diagnostic process patients undergo, so that they are able to explain to the patient what to expect if lung cancer is detected by this route. So I think they're able to answer the questions and anxieties of the patients who actually land up on the van and undergo the lung health check process. So what happened during first round last year worked really well. It was face-to-face sessions in the mobile unit, you will see. In community, and our staff nurses team really enjoyed being there. They would have huddle in the morning, then length of clinics, and then huddle again in the end of the shift to discuss how things went during the day, learn from examples and share examples. It is very, very important for the staff nurses to actually rotate. It is a monotonous, tedious, long hours to just be on the van and do assessments one after the other and one after the other. So we have tried rotating the lung health check nurses between the hub, where they can just come back from the van and just focus on the CT results, and I'll talk more about that in a bit, and between the vans. So it gives them a bit of opportunity to get released from the tedious work they do on the van, to be honest. It's a lot of talking you do there. But when in the first round, all the nurses were based on the van, they were running independent clinics, going through the respiratory symptoms, history, consultation, doing risk assessment, identifying patients who would qualify for CT, and talk through that. And also those patients who would not qualify for CT, obviously those participants have questions. They would ask, they are anxious, why not? They would perform spirometry, do a brief smoking cessation service, and then 5 minutes and then refer them. However, we know the program was paused. A great disappointed, I must say, at that point. But the work never stops if the program is paused, because the hub work carries on for weeks. So we have nurses who continued working and actioning the results from the CT scans which were done earlier. So I would say some of our nurses who were shielding during our pandemic, they stayed back in the hub. They either did the COVID follow-up clinics or they continued with the hub work left from the earlier weeks. But it gave an opportunity to our nurses to upskill. And when they were redeployed mainly to the COVID respiratory ward. They managed to get upskilled about the non-invasive ventilation. One of our staff went to the home ventilation for 12 months and has rejoined us back. So it gave them opportunity to actually expand their skill as a respiratory nurse specialist. And they're coming back with that skill and knowledge to us again, understanding more about respiratory symptoms. A couple of changes have happened since we have restarted this year. There are no more face-to-face clinics. They're all telephone nurse clinics. So the scans are not happening on the same day now. So participants would have an assessment on a separate day, and they would come to one for a low-dose CT on a separate day. We're not doing spirometries anymore. Of course, they had to learn how to do teleconsultation with the participants. That's a new thing they have developed and learned. However, we have broadened the amount of work, or we expanded the work the lung health check nurses are doing now. So they are covering more hub. They have taken a lot of work from clinicians and interpreting the CT reports, joining the radiology review meetings twice a week, communicating with the GPs, participants, doing telephone clinics to convey the results, reassuring patients if they want a call rather than just a letter. So it's a very busy job, I must say. The Lung Health Check Hub is a very busy environment. The only thing I would say what is happening now, we're still running at 6 lung health check nurses. It is a stretch, as I said. The only issue is if anyone goes off sick, which of course will happen, we don't have much leeway. We have to cancel clinics or the pause hub work. So that is difficult. So sustainability is very important. Retention of the staff is very important. And the recruitment is an ongoing process. We started with the 8 lung health check nurses. We lost 5 during pandemic. And we have actually recruited successfully more, and we are still recruiting. So that is something to bear in mind when you're designing your work. I think that pretty much says everything. The standard operating policies for the hub work, and it's been a very lengthy document. I think our nurses, including Jo, has worked a lot, and every few months we keep changing it because you find something new. And you find new ways of working and better ways of working as well. So that process will continue. It's not something you'll design one day and it will sit aside in a shared folder. No, you'll keep going back and keep updating it. So overall, I think when I talk to our lung health check nurses, we have AC down here. Sorry to put you on the spotlight, but they're really proud to be a part of this service. They really feel satisfied that they're giving something back to community, and they're engaging with the participants on a regular basis, and they always have stories to tell every day. So a round of applause to them, I would say. I think I'll just finish on that. Excellent feedback. we have received, and this is an ongoing thing, this is not the first feedback we have received, I think it's quite consistent.